As a way of continuously improving maternal health among rural communities, the Presbyterian Church of Ghana Health Service, North, in 2013, evolved an innovative project dubbed Maternal Health Social Accountability Project to improve access to maternal health care services in the Busa North, Pusiga, and Binduri districts of the Upper East region of Ghana, where maternal health indicators were low. The local communities refer to the project as Ginla, meaning strengthening capacity.
When we talk about maternal health, it has so many components. We have productive life for mothers, we have delivering healthy babies, we have antenatal, postnatal, all these aspects, making sure that mothers and their children, they live very strong and productive life. But try as the nation has done, maternal mortalities keep on happening. We have put the blame sometimes on the technical people like the doctors and the nurses and midwives. Sometimes we have said that the road network, sometimes we have also blamed the women themselves. They don't take antenatal serious, they don't eat well, they don't report malfunctions in their body when pregnant. All these we have looked at them. By and large, addressing some of these concerns, we've had some results. The gap was, what role can the society at large and other key stakeholders who are not directly into healthcare also play in supporting maternal health? And so the objectives here is to build capacity of communities, get the involvement of other stakeholders whose input are very important but may not directly link themselves to healthcare, like the local authorities, like the members of parliament and the rest.
The subject of maternal health is one which is touchy. Now, Presby Health Services North has been quite a very important partner to the Ghana Health Service. Increasing populations and increasing complexity of the determinants of maternal health services, and knowing that yes, we still have very, very high inequalities, it becomes imperative that as partners we should continue to strive to develop new strategies which should be able to then get us to move towards universal health coverage, to the health goal as determined in the Sustainable Development Goals, and this we can do through partnerships.
From our angle, being the people who are championing health in the district, MHAP has actually come to play a very important role in this as far as health delivery is concerned. Stakeholders quarterly review meetings that have created an opportunity for the stakeholders to come together and fashion out strategies that we will use to improve maternal health in the district. In the area of infrastructure, the stakeholders meetings have also helped to push the district assembly and others stakeholders to put up more PHIP compounds or health facilities that will help improve the health service delivery in the district. For instance, before MHAP came in around 2014, there were about 9 functioning PHIP compounds. When MHAP arrived, the number of functioning PHIPs have increased to 21 as at now, as at the ending of 2016. And so this infrastructure development has led to an increase in number of staff, especially the midwives who are taking care of deliveries. As at the time MHAP started, there were about 10 midwives in the district. The number increased to 25, somewhere in between 20 14 in 2016, and as of now, before the ending of 2016, we have as many as 32.
Just recently, one of our members brought a mother to the Sanima District Hospital, and the woman happened to pass on. And when they were taking the body to mortuary, I don't know whether the mortuary man or whosoever charged them that they should bring 100 Ghana cedis. So when our members got there, then one of our ladies said, well, you have collected the money, where is our receipt? He said, oh, this is what we do always. We take money when we are taking corpse to the mortuary. We don't give receipts. But the girl says, no, this is my right to have my receipt. Once I pay money, I must have my receipt. So where is the administrator? I must take my receipt from him. So they went back to the daughter, and the daughter said, no, they should release the money quick. Otherwise, it is going to create a problem, because these people know what they are about. And the money was being released. Today, though the health institutions have not yet completely changed, but we know our rights.
We approached the MP and the district chief executive and followed up with letters, and eventually were given this ambulance.
The committee has been of a very good help to the facility as a whole. Their main role that they've been playing is the advocacy and the lobbying, and through their efforts they were also able to lobby to a different route, and then we had an accommodation. A 4-room was built with kitchen and a bathroom.
The center was not well patronized previously due to poor conditions. The women were delivering at home, which was dangerous to their health. With the involvement of the Community Health Committee through lobbying the district assembly and politicians, we now have an appealing environment. Pregnant women are being delivered safely, and they are very happy.
When the committees were set, it had a representation of all the people that were required. For instance, the politicians were in there, the traditional opinion leaders were there, and then disabled people were there. And as I speak, they were so influential and supportive. Nakun were able to lobby with the politicians, the Honorable MP and the district chief executive, and they built such a big structure.
Oh, we had a lot of problems here. The challenges, one of them was transportation, one of them was just that they will not visit the facility to deliver, because in 2008 we had 1 delivery for the whole year. In 2009 we had 3, and then in 2010 we had 8. In 2011 we got up to 15, and we're getting up to 18 in 2012 before I left. But when I came back, I realized that with the MHAP, that our delivery had increased, and then we get up to 10 or 20 deliveries in a month.
There was no place for our pregnant mothers who come here to maybe urinate or bath. We lobbied with the MP for Bindori, and were given a urinary pit plus a bath. We also appealed to members of the community, and were given a bed by one of the members, community members. Then we were looking for water for the staff. Actually, the assembly has helped us with a facility for water, a small water system. We have given it to them, and they are enjoying.
The time I came, this structure wasn't there. So we used to do our weighing under the tree. Because that time, when it's threatened to rain, and I just come from my outreach, and it's going to, I have to go back because there wasn't any place for me to render my service. But since this structure has been put on, once it's raining, we still do our weighing because we have a place to sit. And also that time, when I just come for my home visit, around 10 going, when I finish, I have to go back. But since this structure started use, when I finish, I have to come and sit here. So I will be here if there's an emergency case, like a pregnant woman who is on labor. I will just pick my motor and send the person.
This one-room structure used to serve as a store, OPD, consulting and weighing center for the Ikpian community in the Bosa North District. As a result of lobbying the District Assembly by the Community Health Committee, the community was provided with this new and spacious PHIP center thanks to MHAP.
MHAP has come here to enlighten us to get health committee members to represent the Zwobiliga chiefs. During the past years, we have been working with the staff in the chief centers, working with the community members, and also with the assembly, the district assembly. When we came to start our work, the nurses here weren't having any accommodation. That was our first target, really. Then they are supposed to work 24 hours. It was very difficult for them. We lobbied through the district assembly, through our health directive. We had gotten the accommodation for the staff. Now that we have gotten the residential accommodation, the next thing is we are now lobbying with the district health directive to get a midwife.
The community scorecard was actually the thing that brought about the improvements, because but that was the committees used that picked baseline information on service delivery based on some indicators in the scorecard, and then because they were tracking and they're reporting on the performance on quarterly basis and presenting to staff, staff were actually challenged to improve on the services that were found to be not up to standard.
Gurimi Peter, the nurse in charge of the Zwobiliga chiefs, indicated that the introduction of the scorecard approach to assess the performance of health services providers challenged the health staff to put in their best.
True that I made work very fast.
To keep the spirit of MHAP alive is to sustain the community health committees.
From what we have experienced for these past 3 years, I think that most stakeholders should learn on the best practices that MHAP has brought on board. And if we all collaborate in this manner, we are going to move ahead maternal health indicators in the region. And therefore, if Ghana Health Service and other stakeholders in the health delivery adopt our concept of community health committees and our strategy in carrying out this program, it will go a long way to help the region.